Look, today I need to have a serious talk with you. If you're over 60 or have someone you love in that age group, pay close attention to what I'm about to tell you. Because over all these years treating patients, I've lost count of how many times I've seen people come in with a heart attack after taking a medication the night before. And the worst part, my friend, is that most of the time it was a medicine prescribed by a doctor, bought at the pharmacy, and taken exactly as directed on the label. Today I'm going to show you who these 6 silent villains are, the ones attacking the hearts of so many good people out there. And listen, I'm warning you right now. The last medication on this list is going to shock you because it's a drug that's inside the purse, the kitchen drawer, and the bathroom cabinet of practically every Brazilian over 60. Is it in yours too? Before we continue, do me a favor. Hit that like button, subscribe to the channel so you don't miss any of our health conversations, turn on the notification bell, and most importantly, share this video with someone you love. Send it to your dad, your mom, your aunt, your neighbor. Because one share from you could literally save someone's life, and that person will thank you for the rest of their days. While you're here, tell me in the comments. Have you or someone in your family ever had a heart attack? Did you ever suspect that a medication might have contributed to it? And also, let me know which part of Brazil you're watching from right now. I love knowing where you all are. It's part of this big family we've built here. Before we dive into the list, I need to give you a very important warning. This video is not a substitute for seeing your trusted doctor. Don't stop any treatment on your own. Don't change your dose. Don't make decisions alone based only on what I'm saying. What I want is to give you knowledge and information so you can talk to your doctor as equals. Got paper and pen? Then let's go, because this conversation is going to change the way you look at that medicine box sitting in your house. Villain number 6. This one you've definitely used many times in your life. Nasal decongestants, the hidden enemy inside cold and flu medicine. You know that scene well. You've got the worst cold in the world. Your nose is completely blocked. It feels like there's cement in there. You can't breathe properly. You can't sleep. It's miserable. So you run to the pharmacy, grab a Deconjax, a Naldicon, a Serene, and in 20 minutes, it feels like a miracle happened. Your nose clears, you take a deep breath, and you get that huge sense of relief. But pay attention to what nobody tells you about these medicines. Substances like pseudoephedrine and phenylephrine don't just work on your nose, my friend. They act like a clamp, squeezing all the blood vessels in your body, including the small arteries that carry blood and oxygen to your heart. They release norepinephrine, the stress hormone. Now think with me about what's happening to your heart in that moment. It starts beating harder and faster, trying to push blood through tubes that just got narrower and stiffer. If you're over 60 and already have some plaque buildup here and there in your arteries, and that's more common than you think, all this pressure can cause a spasm. The artery closes and doesn't open again on its own, and just like that, you bought yourself a heart attack at the pharmacy. An important study showed that these decongestants double your chance of having a heart attack or stroke in the hours right after using them. And here's the crazy part. In 2023, the American Health Agency, the famous FDA, concluded that oral phenylephrine, the one found in almost every cold medicine you buy, is completely ineffective. It doesn't work. So you're accepting the risk of a heart attack in exchange for a benefit that doesn't even exist. It's the worst deal of your life, no doubt about it. So what should you do instead? Use saline nasal spray, do nasal irrigation, use a humidifier in the room, or take a hot shower with steam. If it's really bad, talk to your doctor about loratadine. It's much safer for your heart. Don't trade your life for 20 minutes of a clear nose. It's not worth it. And there's one more trap, okay? A lot of older people take cold medicine together with our next villain on the list. Can you guess which one it is? Villain number 5, anti-inflammatories. You wake up with a headache and take ibuprofen or nimesulide. Got back pain? You go straight for Cataflam, Jalol, or Flanax. It seems like the most normal thing in the world, right? After all, these are some of the best-selling medicines on the entire planet. But what happens inside your body when you swallow that little pill is scary. Let me explain. Imagine your arteries have a personal bodyguard, a strong guy standing there watching the house. His name is prostacyclin. His job is to keep blood flowing freely and stop platelets from sticking together and forming a clot. When you take ibuprofen, diclofenac, or nimesulide, you block an enzyme called COX-2 and fire that bodyguard. Without him on duty, your body goes into triple collapse. First, your blood vessels constrict and your blood pressure shoots up. Second, your blood gets thick, like glue. Platelets become sticky and form clots way too easily. Third, your heart gets overloaded. Your kidneys stop filtering properly, your body retains sodium, and your heart has to beat with crazy force just to keep up. In short, it creates the perfect storm for a heart attack: narrowed vessels, clots forming, and an exhausted heart. And I'm not making this up. This is what the science says. In 2015, the FDA put its foot down and reinforced the official warning. The risk of heart attack can start in the very first weeks of use, even in people who've never had heart problems before. Look at these numbers from studies by Mayo Clinic and the journal JAMA. Diclofenac, the famous Cataflam and its generics, increases the risk of a cardiac event by 70%. High-dose ibuprofen more than doubles your chance of having a heart attack. But calm down. There's one exception that actually saves lives. Low-dose aspirin, AAS, does the exact opposite. It protects the heart. And dipyrone and paracetamol, which are painkillers and not anti-inflammatories, are also safe for your heart. So if the pain gets bad, don't risk your life. Talk to your doctor about these safer alternatives. Now, if you thought anti-inflammatories were already dangerous, just wait until you hear the next villain, because this one is sitting in the medicine cabinet of 7 out of every 10 Brazilian families. Villain number 4, omeprazole and proton pump inhibitors. This is the medicine I told you would shock you. Omeprazole, pantoprazole, Nexium, esomeprazole. These famous stomach protectors are inside the bags, toiletry cases, and drawers of 70% of Brazilians over 60. Everyone thinks they're harmless, like sugar water, that you can take them forever with no problem. But science has discovered something surprising in recent years. These medicines don't just work on the stomach, they attack the cells that line the inside of your blood vessels. Have you heard of nitric oxide? It's a precious gas your body produces to keep your arteries relaxed, young, and flexible. These medicines crush the production of that nitric oxide. Without it, your vessels get stiff and inflamed, and atherosclerosis, the buildup of fatty plaques, speeds up dramatically. A massive study from Stanford University with almost 3 million patients showed that people who use omeprazole and similar drugs have up to 21% higher risk of heart attack. And this showed up even in young, healthy people. Another study found that long-term, continuous use can double the risk of dying from cardiovascular causes. But I want to be fair here. I'm talking about people who've been taking it for months or years without ever stopping. If it's occasional use, 7 days for gastritis or 10 days for irritation, relax, no need to panic. The danger is in blind, continuous use without any reassessment for years on end. Talk to your doctor, get it reevaluated, and check if you still need it. Now we're leaving the stomach and moving to the brain. The next villain is the drug of the moment. Plenty of adults in their 60s are taking it to perform better at work, to study, or to prepare for exams. You're probably curious to know what it is. Villain number 3, stimulants, ADHD medications, focus drugs, and weight loss aids, Ritalin, Vivanza, Concerta. What used to be medicine only for hyperactive kids has become a craze among adults who want total focus. Taking an exam? Take some Vivanza. Want to study more? Take some Ritalin. But there's a serious problem. These medicines flood your bloodstream with adrenaline. Your heart starts beating much faster, your vessels constrict, and your blood pressure rises. A 2023 Swedish study that followed 278,000 people revealed something worrying. 5 years of use increases the risk of cardiovascular disease by up to 27%, and the risk of high blood pressure jumps to a shocking 80%. And in people over 66, the risk of hospitalization for a cardiac event rises by 40% in the first 30 days alone. And be careful with those so-called natural products too, the weight loss pills and pre-workouts sold in supplement stores. Many hide dangerous stimulants that were never approved by health agencies or have already been banned. I've seen cases of cardiac arrest caused by those colorful little bottles that promise the world. Don't play with this. Villain number 2. Corticosteroids. Prednisone, Decadron, and the famous Diprospan. You know that shoulder pain that disappears in 2 hours after an injection? It feels like a miracle, right? But corticosteroids attack your heart in 4 ways at the same time. First, they make your body retain sodium, which raises your blood pressure. Second, your blood sugar spikes, which can even throw a diabetic off balance. Third, your cholesterol gets worse. Fourth, your blood becomes thicker, making clots more likely to form. A study published in the journal PLOS Medicine showed that prednisone doses above 7.5 milligrams per day, when used for long periods, double the cardiovascular risk. And here's the trap. The patient gets 1 shot of Diprospan and thinks it was just a little injection. In reality, that ampule is equivalent to almost a month of pills working inside your body, overloading your heart in a silent and dangerous way. And the person doesn't even realize it. And now we've reached the last one, the most controversial of all. The so-called elixir of youth that became a craze among men over 50 and also among women in menopause, but which can turn into Russian roulette if used the wrong way. Villain number 1, testosterone. Durateston, Deposterone, hormonal implants, testosterone gel. Clinics in Brazil have exploded with prescriptions for these. A lot of men are using them without even having a proven deficiency. The guy walks into the office and says, "Doctor, my testosterone was at 500, you know? I needed to start using it." And I ask, was it low? It wasn't. He didn't need to be taking it. In 2014, a study with 55,000 men showed that in the first 90 days of use, the risk of heart attack increased by 36%. In men over 65, that risk doubled. And when it doesn't cause a heart attack, it can cause a stroke. I've seen a super healthy patient with a perfect checkup who had a stroke and was left with lasting damage after just 1 testosterone injection. Why? Because testosterone can make your blood as thick as honey. It's that simple. But people are going to comment below, "Doctor, I only use the gel. It's not that strong." Hold on, don't fall for that. A study published in JAMA showed that testosterone significantly increases the volume of soft, non-calcified plaques inside the coronary arteries. And these are the most dangerous plaques of all, the ones that look calm, but can rupture at any moment and cause a sudden, fatal heart attack. And then there's the beauty chip crowd. I feel so good, with so much energy, my libido is through the roof. Look, let me give you my clear and firm opinion here. I am against the use of external testosterone that your own body isn't producing, except in extremely selected cases with proven deficiency and constant medical supervision. Period. Now, there is a gray area. The 2023 Traverse study showed that in well-selected and well-monitored patients, testosterone can be safe. I repeat, well-selected. The danger lies in that fancy clinic run by a newly graduated doctor who wants to make quick money, or in some back-alley clinic that prescribes without any criteria. Using high doses without proper testing beforehand and without monitoring your blood during treatment is gambling with your life, and it's not worth it. To recap, my friends, anti-inflammatories, nasal decongestants, omeprazole, stimulants, corticosteroids, and improperly prescribed testosterone. These are the 6 silent villains that may be attacking your heart right now without you even realizing it. My simple request to you is this: don't stop anything on your own. Take this information, write it down, and bring it to your trusted doctor, the one you like and who knows you. And ask firmly, Doctor, do I really need this medicine? Is there a safer alternative for my heart? This simple question saves lives. I guarantee it. And hey, do you want to know which medicines actually protect the heart? There are some that do the opposite and genuinely shield your heart. If you want me to make a video just about that, type protectors in the comments below. If I see enough people asking, I'll record it with a lot of care for you. Remember to leave your like, share this video with someone you love, and subscribe to the channel if you haven't already. My name is Doctor, and I'll see you in the next video. Big hug, and take good care of your heart.